Most people have no idea how often prostate cancer is missed until it's too late. The scary part is that many early symptoms look completely normal. Men assume it's just aging, stress, or minor urinary changes. But ignoring these early warning signs is exactly why prostate cancer remains one of the most commonly diagnosed cancers in men worldwide. In this video, we'll look at the 13 early warning signs you should never overlook. These symptoms can appear weeks, months, or sometimes even years before the disease becomes severe. But most men never recognize them. Just imagine this. If you understand a few key symptoms today, you'll know whether you're safe or if you need medical attention. Stay with me until the end because by the last symptom you'll be able to say with confidence, "I'm safe," or "I need to get checked." And yes, the last symptom is something 99% of people ignore. And this one sign alone is the reason so many prostate cancers are detected late. Before we start breaking down the 13 symptoms, there's something important you should know. Many of these signs can also appear in other common health conditions. That's why it's crucial to stay until the end, because I'll also explain which symptoms are extremely serious and which combination of symptoms means you should see a doctor immediately. All right, let's get started with the first sign. Number 1. Frequent urination at night. Waking up multiple times at night to urinate is one of the earliest and most overlooked warning signs of prostate cancer. It may seem harmless at first, but it often means something is interfering with the normal flow of urine. When the prostate begins to enlarge or develop a tumor, it presses against the urethra, the tube that carries urine out of the body, making it harder for the bladder to empty properly. Sometimes it's just one extra bathroom trip. Sometimes it's a constant urge that wakes you from sleep, even when the bladder isn't full. Many men ignore it or blame aging, drinking water late, or stress. But prostate-related nocturia has a very different pattern. The urge feels sudden, urgent, and often comes with a weak or interrupted urine stream. You might experience it for a few nights, then feel normal again, which makes it easy to dismiss. But repeated nighttime urination is a sign that the bladder is under pressure and working harder than it should. This pressure builds when urine can't flow freely due to prostate obstruction. As the condition progresses, nighttime trips can become more frequent, sleep becomes disrupted, and daytime fatigue begins to set in. Over time, this constant strain can affect bladder control and overall quality of life. Frequent urination at night is not just an inconvenience. It doesn't matter if you're getting older or otherwise healthy. Regularly waking to urinate is not something to ignore. Early evaluation can help identify prostate problems at a stage where treatment options are far more effective. Number 2. Weak urine flow. A weak or slow urine stream can be an early sign that the prostate is affecting how urine leaves the body. Instead of flowing smoothly, urine may come out with reduced force, making it harder to empty the bladder completely. This happens when changes in the prostate narrow the urine passage, creating resistance during urination. This doesn't always feel alarming. Sometimes the stream just seems thinner than usual. Other times it may start strong and then suddenly slow down or stop. Many men ignore this change or assume it's due to dehydration or temporary bladder issues. But prostate-related urine flow changes follow a different pattern. The stream often lacks pressure and feels difficult to control from the very beginning. You might notice this only occasionally, especially in the morning, and then forget about it during the day. That inconsistency makes it easy to overlook. But a weak stream often means urine is struggling to pass through a restricted area, leaving the bladder partially full after each visit. As this problem continues, urination can take longer, require straining, or leave you with a lingering feeling that you haven't fully emptied your bladder. Over time, this strain can stress both the bladder and urinary system. A weak urine flow is not just a minor change. Even without pain or discomfort, it signals that something may be interfering with normal prostate function. Identifying this early can help prevent further urinary problems and allow treatment at a stage when outcomes are much better. Number 3. Painful ejaculation. Painful ejaculation is a symptom many men find difficult to talk about, but it can be an early sign that something may be affecting the prostate. The prostate plays a key role during ejaculation by producing fluid and helping move semen smoothly through the reproductive tract. Under normal conditions, this process happens without pain or discomfort. When changes begin to occur in the prostate, this process can be disrupted. Inflammation, pressure, or abnormal tissue growth can interfere with the nerves and muscles involved in ejaculation. Even small changes inside the prostate can create sensitivity or irritation during this moment. As a result, some men begin to notice discomfort, pressure, or a sharp pain during or immediately after ejaculation. The sensation may feel deep inside the pelvis, behind the pubic bone, or near the lower abdomen. What was once painless may suddenly feel uncomfortable or unfamiliar. At first, this pain may appear only occasionally, making it easy to ignore. Some men assume it's temporary or related to stress or fatigue, but when this sensation repeats, it often signals that the prostate is no longer functioning as smoothly as it should. Over time, this discomfort can create hesitation or anxiety around sexual activity, affecting both physical comfort and overall well-being. The change feels subtle at first, but it often stands out because it is not normal for the body. This isn't just a temporary sexual issue. It can be the prostate's way of signaling that something deeper may be affecting its structure or function. Number 4. Blood in the urine or semen. Blood in the urine or semen is a serious warning sign that something may be affecting the prostate, yet many men overlook it or assume it's harmless. The prostate sits close to the bladder, urethra, and reproductive ducts, all of which are surrounded by tiny, fragile blood vessels. When healthy, these vessels remain intact and unseen. But when abnormal changes begin inside the prostate, these vessels can become irritated or damaged. A growing tumor or inflammation can place pressure on nearby tissues, causing small blood vessels to rupture. When this happens, traces of blood can leak into urine or mix with semen during ejaculation. In the early stages, the amount of blood may be very small. You might notice a pink, brown, or rusty color in urine or faint red streaks. Sometimes the change appears only once, which makes it easy to dismiss or blame on temporary irritation. But blood from the prostate does not appear without a reason. As time goes on, this bleeding may return more often or become more noticeable. This happens because the underlying irritation or growth continues to affect surrounding tissues, allowing blood to escape repeatedly. Blood in the urine or semen is not a normal finding. When it appears, even briefly, it is the body's way of signaling that something inside the prostate or nearby structures may be damaged or under stress. Early recognition of this symptom can be critical because identifying prostate problems at an early stage greatly improves treatment options and outcomes. Number 5. Pelvic discomfort. Pelvic discomfort is a subtle but important symptom that many people overlook or dismiss as a routine issue. The pelvic region contains vital organs, nerves, muscles, and blood vessels that work together to support urination, bowel movements, and reproductive functions. This problem doesn't appear suddenly. It often starts with hesitation, where you feel the urge to go but need extra time before urine begins to flow. Many people misunderstand this and assume it is just a normal sign of aging, stress, or drinking less water. But cancer-related blockage develops slowly and keeps worsening. At first, the flow may stop and start, or you may feel unable to fully control when urination ends. This makes the symptom easy to ignore, but repeated difficulty means the bladder is working harder to push urine past an obstruction. Over time, the bladder can weaken, leading to longer bathroom trips, strain during urination, or a feeling that the bladder never fully empties. Difficulty starting or stopping urination is not harmless. When urine cannot flow properly, it can back up and cause infections, bladder damage, or kidney problems. Early testing helps find prostate cancer before permanent urinary damage occurs, when treatment can relieve pressure and protect long-term bladder and kidney health. Number 11. Sudden urge to pee. A strong, urgent need to urinate that comes without warning can be a concerning sign, because prostate cancer can disrupt how the bladder and nerves communicate. When cancer affects the prostate, it can irritate nearby nerves or disturb normal bladder signals, causing the bladder to contract suddenly, even when it is not full. This sensation often develops quietly. At first, you may feel a quick urge that forces you to rush to the bathroom, especially during the day or after drinking small amounts of fluid. Many people misunderstand this and think it is due to caffeine, anxiety, or a sensitive bladder. But cancer-related urgency occurs more frequently and feels harder to control. Early on, you may still make it to the bathroom in time, which makes the symptom easy to dismiss. However, these repeated urgent signals mean the bladder is being overstimulated by an abnormal process. As the condition progresses, the urges can become more intense, happen more often, or occur at night, interrupting sleep and daily routines. A sudden urge to pee is not just inconvenient. Loss of bladder control risk increases, and ongoing nerve irritation can weaken bladder function over time. Early evaluation matters because identifying prostate cancer at this stage can prevent long-term bladder problems and allow treatment before urinary control is seriously affected. Number 12. Unexplained weight loss. Losing weight without trying can be a serious and often overlooked warning sign because prostate cancer can quietly change how the body manages energy, nutrients, and muscle strength. Cancer cells grow aggressively and demand constant fuel, pulling energy from fat and muscle stores even when a person is eating normally or feels no change in appetite. This process usually begins slowly. At first, you may notice your clothes fitting looser, a drop in body weight on the scale, or a slimmer face without any effort. Many people misunderstand this and assume it is caused by stress, working harder, eating less, or simply getting lean. But cancer-related weight loss happens without intentional lifestyle changes. Because the change is gradual, it is easy to ignore or even feel satisfied by it. However, unexplained weight loss means the body is under internal pressure and normal metabolism is being disrupted by an abnormal process. As the condition progresses, the body may start losing muscle instead of fat, leading to weakness, reduced stamina, and fatigue that does not improve with rest. Everyday activities can begin to feel exhausting. Unexplained weight loss is dangerous. It often signals that cancer is no longer limited to one area and may be affecting the entire body. Early medical evaluation is critical because identifying prostate cancer before severe weight and muscle loss occurs allows treatment to work more effectively, helps preserve strength, and greatly improves recovery and long-term outcomes. Number 13. Fatigue or persistent weakness. Feeling constantly tired or weak can be a serious warning sign because prostate cancer can interfere with the body's energy production and nutrient use. Cancer cells consume energy rapidly and may affect hormones or blood production, leaving the body struggling to maintain strength and stamina. This symptom often develops gradually. At first, you may feel unusually tired after simple tasks like walking upstairs, carrying groceries, or completing your usual daily routine. Many people misunderstand this and think it is just due to aging, stress, busy schedules, or lack of sleep. But cancer-related fatigue is persistent and doesn't improve even with rest or relaxation. Early on, fatigue may come and go, making it easy to ignore or push through. However, this ongoing weakness is the body signaling that something inside is straining normal function, including muscles, nerves, and energy systems. As the condition progresses, fatigue can become more intense, affecting both physical and mental abilities. Simple activities may require extra effort. Concentration may drop, and even getting out of bed can feel exhausting. Persistent weakness is not harmless. It can indicate anemia, hormonal imbalance, or the cancer spreading beyond the prostate, all of which can reduce quality of life and physical health. Early detection is vital because addressing prostate cancer at this stage can restore energy levels, prevent further physical decline, and improve treatment outcomes while giving the body a chance to recover strength. Number 14. Loss of appetite. A sudden or persistent loss of appetite can be a serious warning sign because prostate cancer can disrupt how the body processes hunger signals and nutrients. As cancer grows, it can affect hormone balance, metabolism, and even how the digestive system communicates with the brain, making normal hunger cues weaker or confusing. This symptom develops gradually. At first, you may notice a slight disinterest in food, skipping snacks, or feeling full earlier than usual. Many people misunderstand this and think it is caused by stress, dieting, illness, or a busy lifestyle. But cancer-related appetite loss happens without intentional changes and continues even when you try to eat normally. Early on, it may be subtle, making it easy to dismiss. However, ongoing appetite loss signals that the body is not receiving or using nutrients properly, which can weaken energy, immunity, and organ function over time. As the condition progresses, meals may become less appealing. Weight loss can accelerate and fatigue or weakness may increase because the body is not getting the fuel it needs to function. Loss of appetite is not harmless. It can indicate that cancer is affecting metabolism, hormone levels, or even spreading to other areas of the body. Early evaluation is crucial because detecting prostate cancer at this stage allows interventions that can restore appetite, improve nutrition, maintain strength, and make treatments more effective. If you noticed any of the symptoms we discussed today, even if they seem mild or come and go, please don't ignore them. Prostate cancer often stays silent until it becomes serious, and early detection can make a life-saving difference. Your body speaks in signals: sudden urge to pee, painful and burning urination, erectile difficulties, blood in the urine, unexpected weight loss, pelvic discomfort. These are not things to overlook. You deserve answers and you deserve peace of mind. So if something doesn't feel right, talk to a healthcare professional. A simple checkup, a scan, or even a basic examination can give clarity and potentially catch a problem before it becomes dangerous. Remember, awareness is the first step. Action and your health is worth both. If you found this video helpful, share it with someone you care about. You never know who might need this information today. Take care of yourself, listen to your body, and I'll see you in the next video. When everything is healthy, this area remains comfortable and balanced without persistent pressure or pain. However, when a tumor begins developing in or around the pelvic organs, it can slowly disrupt this balance. As abnormal cells grow, they may press against nearby tissues, irritate nerves, or interfere with normal organ movement. This pressure can create a dull, aching sensation deep in the pelvis that doesn't go away easily. At first, the discomfort may feel mild, a vague heaviness, tightness, or pressure that comes and goes. Many people ignore it, assuming it's due to sitting too long, muscle strain, digestion problems, or stress. But unlike temporary discomfort, cancer-related pelvic pain often becomes more noticeable over time. As the tumor grows, it can increase pressure on surrounding structures such as the bladder, rectum, or pelvic floor muscles. This may cause a constant feeling of fullness, uneasiness while sitting, or discomfort that worsens during urination, bowel movements, or physical activity. Pelvic discomfort that lasts for weeks, keeps returning, or gradually intensifies is the body's way of signaling that something inside the pelvis may not be functioning normally. While many conditions can cause pelvic pain, persistent or unexplained discomfort should never be ignored. Recognizing pelvic discomfort early and seeking medical evaluation can help detect serious conditions at a stage where treatment is far more effective. Number 6. Incomplete emptying of the bladder. Feeling like your bladder doesn't fully empty after urinating is an important warning sign of prostate cancer. Even when you finish using the bathroom, it can feel as if urine is still trapped inside. This happens because something is interfering with the normal flow of urine out of the bladder. The prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When a tumor begins to grow in the prostate, it can press on or narrow this tube. As a result, urine cannot pass freely, and the bladder may not empty completely. This doesn't always feel obvious at first. Sometimes it's just a mild sensation, a lingering pressure, a feeling that you need to go again right after finishing, or the urge to strain slightly to empty more urine. Many people ignore this or assume it's just aging, dehydration, or stress. You might urinate, walk away, and then feel the need to return to the bathroom minutes later. This repeated urge happens because leftover urine remains in the bladder, sending signals that it's still full. As the condition progresses, incomplete emptying can become more noticeable and uncomfortable. The bladder may stretch or weaken from constantly holding residual urine, increasing the risk of infections and further urinary problems. Incomplete bladder emptying is not something to brush off. The bladder is designed to empty efficiently. When it doesn't, it often means there is an obstruction or pressure where urine exits the body. Paying attention to this symptom and getting it checked early can help detect prostate problems at a stage where treatment is far more effective. Number 7. Erectile difficulties. Erectile difficulties can be an early sign that something may be affecting the prostate and the systems connected to sexual function. An erection depends on healthy nerves, proper blood flow, and smooth communication between the brain and the pelvic organs. The prostate sits close to the nerves and blood vessels that control erections. When abnormal growth or pressure develops in this area, it can quietly interfere with these pathways. Signals from the brain may not travel as clearly, and blood flow to the penis may not respond the way it normally should. At first, the change can be subtle. You may notice that erections feel weaker than before, take longer to develop, or don't last as long as they used to. What once happened naturally may start to require more effort or concentration. Many people dismiss this as stress, fatigue, or age. As this interference continues, erectile problems can become more consistent. The body no longer responds the way it once did, even in familiar or relaxed situations. This shift can feel unexpected and out of character for your usual sexual health. Over time, these changes may begin to affect confidence and intimacy, adding emotional stress to the physical symptom. The issue may no longer feel occasional, but instead part of a growing pattern. This isn't just a temporary performance issue. It can be the body's way of signaling that something deeper may be affecting the prostate and nearby nerves. Number 8. Painful or burning urination, dysuria. Painful or burning urination can be an important warning sign that something may be wrong within the prostate or urinary system. Yet many people dismiss it as a minor infection or temporary irritation. The urinary tract is lined with sensitive tissues that allow urine to flow smoothly and without discomfort when everything is healthy. But when abnormal growth or inflammation begins near the prostate, it can disturb this delicate lining. As changes develop, pressure or irritation can affect the urethra, the tube that carries urine out of the body. This irritation can create a burning or stinging sensation during urination. At first, the discomfort may feel mild. You might notice a slight burning at the start or end of urination or a brief sharp sensation that fades quickly. Because it can come and go, many people ignore it or assume it will resolve on its own. Over time, the sensation can become more noticeable or more frequent. The burning may last longer, feel more intense, or occur every time you urinate. This happens because the underlying irritation continues, placing repeated stress on the urinary tissues. Pain or burning during urination, especially when it persists, is the body's way of signaling that the urinary pathway may be inflamed, compressed, or damaged. This symptom should never be brushed aside. When identified early, the cause can be investigated before more serious complications develop, allowing treatment to be far more effective. Number 9. Lower back or hip pain. Ongoing pain in the lower back, hips, or upper thighs can be a serious warning sign, because it may mean prostate cancer is affecting nearby bones or nerves. When cancer spreads outside the prostate, it often moves into the spine or hip bones where it weakens bone tissue and irritates surrounding nerves, triggering deep and persistent pain. This pain doesn't always feel alarming. Sometimes it begins as a mild ache, stiffness after rest, or discomfort that feels like a muscle strain or joint problem. Many people misunderstand it and blame age, posture, long sitting, or physical work. But cancer-related pain behaves differently. It does not fully improve with rest, exercise, or common pain medicine. You may feel it for a few days, then notice it disappear, only to return later with greater intensity, making it easy to ignore. But this type of pain is a warning sign because cancer in the bones can silently weaken structure and cause ongoing damage. As the disease progresses, the pain may spread to both hips, worsen at night, or become sharp enough to limit walking or daily movement. Lower back or hip pain should never be assumed harmless. It does not matter if you are active, have arthritis, or recently lifted something heavy. Persistent pain without a clear injury is dangerous. Early testing can identify prostate cancer before serious bone damage occurs, when treatment is far more effective and outcomes are much better. Number 10. Difficulty starting or stopping urination. Trouble beginning to urinate or stopping the flow can be an important warning sign because it may mean prostate cancer is pressing on the urethra, the tube that carries urine out of the body. As the prostate grows due to cancer, it can narrow or partially block this tube, making it harder for urine to pass normally.